Hello, good morning, everyone. We'll start in 2 minutes time, yeah, at 11 o'clock. So while waiting for the rest of them to come in, these are some of the topic of interest to you. Please do scan the QR code or just follow pjefc.org or follow our social media, Facebook and Instagram, and you'll get all this information pushed out to you. These are really good talks coming your way. We hope to have your presence with us too. Let me also say hello to people watching in YouTube. Welcome to you too watching over from the YouTube. So please stay tuned. We are starting in 1 minute's time.
Excuse me, this will be recorded, right? And we
Yes. It will be recorded. So I will give you the information later. Yeah, thank you. So everyone, it's 11 o'clock. I shall start the session right now. Thank you so much for joining us. Good morning and welcome to this special talk organized by PJFC Evangelical Free Church, PJEFC for the community. For PJFC members, hello once again. For those who are not from PJFC, a very warm welcome to each and every one of you. Our church is located in section 13, but for this season, we are not able to gather physically there. So we do meet online. Just want to invite everyone to join us every Sunday, 9:30 a.m. wherever you are. My name is Alexa Ho. I'm a pastor of PJEFC, and I'll be your host and moderator for today. Some of the upcoming talks might be of interest to you. Sexual and gender identity talk. This is a conversation that we would like to have in walking alongside people with sexual and gender identity challenges. You see, for most of us, sexuality is an awkward topic of conversation. So we avoid talking about it at all costs. But just because we avoid talking about it doesn't mean these questions go away and doesn't make it less awkward. In fact, it might even alienate someone who wrestles with sexuality. This talk will address some of the questions as well as a call to provide a safe space for those who wrestle with some of these questions within a community. So next Saturday, 28 August at 10 a.m. Next Sunday, we have Faith in Action Talk, participation in constitutional democracy. I know these are big words. So what does it mean? Now, in this age, we witness rise of nationalism, religious partisanship, and populist politics, which leads to polarization and division. Now, with these recent developments, we invite you to join us to discover how we as Christians can play a part in ensuring our faith does make a difference in this fragile democracy of ours. So this is happening next Sunday, 11 a.m. with our guest speaker, Eugene Yap. For both talks, Zoom details are shown on the screen, or you can visit pjfc.org for more information. For the younger people, we have something exciting every Saturday for you. PJFC Impact Youth meets every Saturday, and for this season, we are exploring God, meaning of life, faith, and purpose in life via Alpha. So curious to find out? Join us Saturday. Details are on screen, or you can contact Priscilla or refer to pjfc.org, our website. Now, today we are here all for this talk, COVID latest developments. Now, I would like to just mention that this talk is a continuation of two related talks previously organized by PJEFC. February 7th, we have our first talk on myth and misinformation, which mainly explain about COVID-19. We clarified several fake news and encouraged everyone to get vaccinated. Then May 2nd, when AZ vaccine was first introduced, we had a follow-up talk on the types of vaccines available. Today, we look at the latest development on COVID-19. Now, in this session, we will address the effectiveness of vaccines, which I hope most of you have received at least one dose, and the COVID variants of concern, such as Delta, Lambda, and also new treatment options like immunotherapy, as well as Ivermectin. So welcome once again, everyone, for joining us. Before we begin the proper session, let me quickly run through a few important things for you to take note. Number one, this talk is also live streamed to our YouTube link. My team will actually put the YouTube link at the chat group. If any one of you friends, your friends or your family would still like to attend this talk, they can head over there as we will be maxing our capacity at 300 for the Zoom session. Immediately, when this talk is over, it will be available on YouTube, yeah? So if any of you miss any part of the sharing or would like to listen again for greater clarification, you would like to share this with others, you can check out the recording immediately after the talk posted at PJFC YouTube channel. Secondly, we request that you stay on mute at all times to avoid interference. If you'd like to ask questions, there will be Q&A session after the speaker completes his presentation. But all throughout the session, you'll be given opportunity to ask questions related to this talk at Slido. So just go to Slido, key in 050505 as the code, and you can ask your question. Click on the link to post your questions. Now with Slido, you can also upvote your questions, meaning if you see a question that resonates with you, it's also a question, I would like to ask the good doctor for a response. You can actually like the question and it will get upvoted. Now, at the end of speaker session, depending on time, we hope to pick the most upvoted and liked questions for the doctor to respond. Our team will also group the questions according to segments and ask the relevant ones. We will ask you to just listen and pay attention throughout the session, because a lot of us come into this session, have a lot of questions in our head. Hold your horses, because I believe that Dr. Fong will be taking us through a really a complete presentation today. So some of your questions might be answered throughout, but after a certain segment, if you feel your questions are still not answered and would like to clarify a certain points, then you go to Slido and post your questions. I understand some of us might not know how to access Slido. It's all right. You can also put your question on the chat and our team members will then help you post your question on Slido. We will also appreciate your help to fill in a feedback form after today's talk for us to know how helpful the talk has been and how we can further improve our talks in the future. We value all constructive feedback. With that, I will now introduce our speaker. Dr. Choong Fong is a church elder of PJEFC, who is a medical doctor who is an eye specialist. Currently, he's the medical director of International Specialist Eye Center, ISAC, at Kuala Lumpur. So I now pass the time to Dr. Choong. Over to you, Fong.
Thank you, Pastor Alexa, for the very kind introduction, and welcome everybody for participating in this talk today. Let me just get my screen to share. Okay, I hope you can see my screen now. Great, okay. So we are now, what, 1.5 years into the pandemic, and a lot of things have changed as far as COVID-19 is concerned. There are lots of different development, lots of different things that has happened. Now, in this talk, I'm going to focus on quite a few things. I'm going to talk about the current COVID-19 infection situation. I'm going to just mention about the COVID-19 vaccines. Just going to touch on vaccine willingness. I'm also going to discuss one of the main topic of discussion would be the COVID variants, especially Delta, and the impact on this pandemic. I will touch on vaccination in pregnancy, vaccination for children, and also all the post-vaccination antibody tests that you have been hearing about. What are some of the new treatment options that's being investigated, and also how to evaluate online health information so that we can get the most accurate information possible. And then we'll end with a Q&A session. So the talk will last probably about 45 minutes, after which I hope we will have about 45 minutes to just address any concerns that you might have. So let's get started. So COVID-19 vaccination. So what is the situation in Malaysia at the moment? So as of yesterday, there are 1.535 million people who have been officially diagnosed with COVID. And that represents a significant amount of the population. Of course, the true numbers may be even higher than that, and of which 13,000, more than 13,000 people have died from this condition. Now, so this condition is a significant health challenge to Malaysia and the world. And if you look at the case per million confirmed COVID-19, if you look at the latest news, you can see that Malaysia here is really high in number. In fact, we are now approaching what United States used to have at its worst when it happened sometime in January. So you can see the numbers per million people is approaching that. And we're even approaching that of UK, okay? So the situation does not seem to look good. Now, in terms of cumulative, that means the total amount of people who are infected per million population, we are still behind United Kingdom and United States. Although you can see the trajectory, if we continue in this way, we may eventually catch up. So Malaysia is in a fairly difficult situation at the moment. And if you look at the number of deaths in Malaysia per million population, you can see that the rate of death, COVID-related death in Malaysia is now approaching that of United States at its worst, which was in January. We are not quite the same league as United Kingdom, which is far worse when it was at its worst in January, but we are approaching that of United States. And we are certainly a lot higher than some other countries in Asia. And how about deaths per million? And you can see here again, Malaysia, we are quite far behind as far as United States and United Kingdom is concerned, because they suffer for a lot longer period. But certainly that our trajectory is getting up. So all these things seems to point towards cause for concern. But if you look at the COVID cases in KL and Selangor, whereby the vaccination rate has been better and higher, you can see that the numbers are now beginning to plateau and beginning to reduce. And that is the case certainly for the Klang Valley. So this is the current situation. We are in a difficult situation as a nation. How about vaccination? Where are we with regards to vaccination? Now, this is the numbers with regards to the whole of Malaysia. So we have given more than 30 million doses, which is actually logistically a big challenge. And I think Malaysia has done really well, despite the fact that we started really late. And if you look at Klang Valley, where most of us reside, you can see that of the total population, almost 80% now are vaccinated. Okay, only the children and the younger children who are not eligible, and some perhaps foreign workers and migrant groups are not well vaccinated. But in terms of adult population, it's actually more than the 100%. Now, the reason why it's more than 100% is because the base population that we use is based on the census previously. And of course, people move in between the census taken previously and now. Therefore, there are more people in Klang Valley than what the census indicate. Therefore, the percentage population is higher than 100%. And of course, the census does not also include migrant population. Okay. So in other words, there are still, although the rate is high, there are still people who are yet to be vaccinated. Now, if you then look at the next slide, which is how many vaccine doses are administered per 100 people. That means of 100 people, how many vaccine doses are given by the country. And you can see in Malaysia, per day, we give about 1.5, which is actually one of the highest in the world currently. We are even doing it faster than when United States and United Kingdom were doing it at its fastest. Okay, so with this regards, I think the vaccination program rollout has been done really, really well. And I have to give credit to the people who are involved in it. Now, in terms of total vaccine doses administered per 100 people, Malaysia now is approaching 90 plus per 100. And we are actually approaching that of the United States. You can see that United States have just given just over 100 per 100 people, and Malaysia actually approaching that. And I anticipate actually within 2 weeks, we may actually have given more doses than the United States. And if you look at the share of people who have received at least one dose, at least a single dose of vaccine, again, is 55% now, and we are actually approaching that of the United States, which is at 59%. And I would anticipate that within 2 weeks, we will actually exceed that of the United States. So in some ways, we have done really well. So bravo to those people who have signed up and went out to vaccinate, and also for those people who are involved in vaccinating. And if you look at the share of fully vaccinated, we are slightly behind because we started late, but I would expect this number to rapidly increase in the next 2 to 3 weeks. Now, just give a very quick snapshot on the vaccine situation and also the infection situation in Malaysia. One chief question is asked is, does COVID-19 vaccine works? If you look at the data from Israel, which have vaccinated a large percentage of the population very early on, we can see that when Israel started initially, they have got a big increase in September, after which they enforced SOPs and the numbers came down. And then the numbers begin to go up again. And that's when they started vaccination in December 2020. And soon after that, the vaccine began to take effect and the numbers begin to drop after a delay of about 4 to 6 weeks for the vaccine to have its effect. And when Israel gets fully vaccinated by April, the numbers at that time becomes actually very, very small. But I'll show you a slide later whereby this begin to change with the Delta variant. And if you look at the same data from the United States, it's showing the same thing. Among the people who are fully vaccinated, okay, the cases of COVID is actually much, much less compared to people who are not fully vaccinated. And you can see this is between 1 to 4% of those COVID positive cases are vaccinated, and a staggering 96 to 99% are among people who are not fully vaccinated. And bearing in mind, the United States at that time vaccinated about half the population, and half the population are not vaccinated. And you can see that vaccine clearly works. So we have no longer this question of does vaccine work, because it clearly does, okay? So from this, the experience of different countries in the world, we know that the reduction of infection is actually effective. The reduction of hospitalization is very highly effective, and the reduction of death is also very highly effective. But how about vaccine willingness? How willing are people to get vaccinated? Now, if you look at the data collected, and this kind of survey are not done all the time, so there's one done in July, 15th of July 2020, you can see that the vaccine willingness to get vaccine differs from country to country. So for the dark blue and the light blue are people who are willing to get vaccinated. Okay, the dark blue is they've already been vaccinated, the light blue is that they're waiting to be vaccinated. But you can see that about 60% in most countries to 70% are willing to be vaccinated. But if you look at the red columns, you can see that these are the people who are not vaccinated, but they are unwilling to get vaccinated. And that differs from country to country. So we have higher willingness in Japan, but certainly a lot lower willingness in, let's say, United States and France. And because of this unwillingness to get vaccinated, it has a bearing, which I will explain later, in terms of how we can achieve herd immunity. Okay, so just bear this slide in mind. What are the COVID-19 variants of concern? So WHO actually divided the variants of concern and variants of interest. Okay, variants of concern are basically variants that actually would impact the effectiveness of all the health measures that we're taking, including your mask and vaccination. Whereas variants of interest are things that potentially can cause a problem, but the data is not quite available yet, and therefore we are observing it with interest. Okay, so that's the difference. Now, of the variant of concern that has been listed by WHO, they listed alpha, beta, gamma, and delta so far. Okay, the one that is most concerning will be delta. Okay, which we will go into later. Beta, with the South African variant, at one point was of concern, but now this is being replaced in most countries by the Delta variant. As far as variants of interest are concerned, there's not quite enough data. We are looking at this with interest, with concern, with some measure of concern are Eta, Iota, Kappa, and Lambda. Okay, and I will again go into particularly Lambda just in a few moments. Now, Lambda variant is first identified in Peru and end of last year, and it's certainly more infectious than the original COVID variant, but it's less infectious than Delta. In fact, Lambda has been present in the United States since January, February, and the way that the fact that it has not overtaken the majority of the COVID cases in United States, but rather Delta means that Delta is overwhelmingly more infectious and more concerning than Lambda. Now, it carries a mutation to the spike protein. Now, there are some evidence to show that there's a higher resistance to vaccine, the effectiveness of vaccine in studies in Chile, and Chile uses Sinovac. But this is not a non-peer review study. But what's important that although the infectiousness of the condition is higher, despite having Sinovac, the amount of people who are harmed by it in terms of hospitalization or having a severe disease is still less. Therefore, the vaccine is still protective. Similarly, Pfizer vaccine is also protective. Now, there are other variants like Epsilon and so on, which we don't have to concern about too much at this moment. Now, I want to concentrate a lot more on the Delta variant because this is the one major challenge that we are facing. Okay. Now, if you look at the share of the variants that are the COVID-19 infections that are of Delta variant among countries, you can see that overwhelmingly in almost all countries in the world, the Delta variant is now the predominant variant. So you can see in United Kingdom, India, United States, it's almost 100% of all COVID cases of Delta variant. Malaysia reported sometime in July that our variant is also approaching, of new infections are actually predominantly Delta variant, and as in the case with Japan. So you can see that this variant is actually overtaking the world in terms of the numbers affected. If you look at this graph, this shows that the confirmed COVID-19 cases. Remember Israel at that time when they started vaccinating, the numbers, the slightly bluish green line here, the numbers of COVID plummeted. But in just the end of last month and into August, the numbers once again is increasing in Israel. In fact, now Israel have got more confirmed cases per population compared to Malaysia, and they are all of Delta variant. So this is bearing in mind that Israel has vaccinated a large proportion of their population, but yet this has not really stopped Delta from infecting the country. And you can see the similar trend in the United Kingdom as well, that the increase happening end of July into August, whereas previously the numbers are quite well controlled. In terms of death, you also can see that the number of deaths following the increase in Delta variant is higher. But what is less concerning is the numbers of deaths are much less. If you compare this to the previous slide, the numbers in Israel and the United Kingdom is, in fact, is high, approaching that of the time in January. But the number of deaths is not in the same trajectory. Granted, there are more, but they are not in the same numbers as proportionally to the infection. But what this tells us is that the vaccine, although it's less effective against the Delta variant, is still protecting the population from severe disease. Now you can see that in Malaysia, although we have started vaccinating quite a lot of people starting July, August, the numbers that we have here is not quite reducing. And the reason why we don't have the same trajectory as when Israel and United Kingdom had earlier in the year when they're vaccinating is because the variant that's affecting them earlier is not Delta. We are now faced with Delta. And therefore, although the conditions sounds worse, numbers are sort of like platooning, not getting really better, it would have been far worse had we not vaccinated the country to the extent that we have done so to date. Okay, so this is again just a closer look at the data from Israel. So when Delta variant is identified in Israel at this point, and soon after that, the numbers of Delta in Israel just increase. And the vaccination that used to be so effective against the first wave or the second wave here in Israel is no longer so effective against the Delta variant. Why is that so? Why is the Delta variant causing such problem? The main thing is that it's a lot more infectious. Now we hear the term R0, okay? This R0, or we call it R0, which is the reproductive cycle of the virus. In other words, without taking any precautions, no SOPs, no vaccination, the one person infected with the COVID virus will infect between 2 to 3 other person. Okay, so let's say it's 3. Okay, for the original COVID. So after one cycle is 3, after second cycle is 9, and then after third cycle is 27. But the R0 for Delta is between 6 to 9. Okay, 6 is conservative, 9 is we think that it can be up to 9 in places that are very crowded and so on. Let's take a conservative value of 6, so you can see the comparison. After one cycle is 3 and 6. After 2 cycles is 9 versus 36. After 3 cycles is 27 versus 216. And just after 4 reproductive cycle is 81 versus 1,296, a 16-fold increase in people infected. And if you take R0 of 9, it's 81 times. And hence the problem, because if we don't get Delta under control, the speed at which it can infect other people is just staggering. Okay, and therefore the unvaccinated becomes highly vulnerable. Okay, and this is the problem because the infectivity is so high. But how about Delta variant's impact on vaccine effectiveness? It has an impact. So studies are beginning to show that the vaccine has reduced capacity to prevent infection, even in fully vaccinated people. For example, I'm fully vaccinated, 2 doses. My chance of, if I encounter someone with a COVID virus, and my reduction risk is only by half, instead of 90 to 95% for the original variant. Okay. So therefore, even when I'm vaccinated, I'm still far more likely than the original variant to develop an infection. But the difference is this: even though I'm infected, I'm far less likely to be symptomatic, and far less likely to be hospitalized compared to if I'm not vaccinated. Okay, and the data for AstraZeneca is a bit more patchy. Okay, we don't really know the infection protection. It varies between 40 to 90, depending on what study you look at. But in terms of symptomatic protection, 60%, and for hospitalization, it's 93%. We don't have much data on Sinovac at this moment. So therefore, fully vaccinated is much safer, although your protection against infection is lower, but the protection against symptomatic as well as severe disease is much reduced. Okay, but the problem is this: the fully vaccinated can still be infected. And therefore, the fully vaccinated can still infect others. In fact, we are told that the initial viral load in our nose area is actually very high. But if you are vaccinated, the viral load decreases very rapidly. And it makes sense because your body is primed against this virus. And therefore, the moment the body detects it, although you are already infected, your body will fight it off very quickly, and therefore the viral load decreases very fast. Okay, and therefore, as your viral load decreases in your body, you will also produce less viral particle, and therefore you're less you're infectious for a shorter period of time. Okay, so take-home message is this: the vaccine still protects. It doesn't protect as well as before, but it protects very well against symptomatic and severe disease. Now, if you look at the situation in Malaysia, this is data from just yesterday. We have 22,000 cases yesterday, of which 2.1% are category 3, 4, and 5. Category 3 means that you have got a lung infection. Okay, category 4 means that you have lung infection but you need oxygen to help you breathe. and category 5 means that you need a ventilator. Now, moving forward, these three categories, the figures for these three categories will be what is most important for us to pay attention to. Category 1 and 2 are mild or asymptomatic, in other words, no symptoms. And if we can keep this percentage of category 3, 4, and 5 low, then we won't have a problem with opening the economy, even if the infection numbers are high. Okay, but we can only achieve this if we go for vaccination, because when we look at the percentage of people who are vaccinated who in category 5, only 10% of people fully vaccinated in category 5 are here. Okay, the 90% are actually not vaccinated. In other words, out of 184 cases, only about 18 to 20 cases are fully vaccinated. Okay, so it's a far different, needing 20 ventilators for the whole country extra for this patient versus needing 184 ventilators if they're not vaccinated. Okay, so that is the very important data that we need to just look into. So moving forward, when we look at the data, we want to pay more attention to this. Now, if you look at the United Kingdom, the experience is also the same. As you can see that this is the proportion of vaccination of the population. So at this time, by about mid-May, United Kingdom has vaccinated more than 60% of its population with at least one dose. And you can see that because of Delta and because of opening out of the Euro soccer games and all the stadiums that you can see are all open and open up the economy, the numbers of cases actually go up really a lot, almost to the same level as when it happens in January. But the difference is this: the amount of deaths over here is no longer replicated here. Although the infection here is a lot, but the number of deaths, although it's increased, but it's not as much as earlier in the year. The reason is because of vaccination. Now, among the people who die in this category, the vast majority are the 40% or the 30% that are not vaccinated. Okay, so again, I want to show this graph to you to show to you the impact of vaccination and the impact of Delta variant. How does the Delta variant impact herd immunity? So at the beginning of the pandemic, everybody was hoping that herd immunity can be achieved. And some people show that if 70% of the population is vaccinated, then we have herd immunity, and then everything will be going back to normal. And people who are not vaccinated will still be protected. We call herd immunity. But with the Delta variant, because it's far more infective, and because it reduces the ability of the vaccinated person from resisting the virus, herd immunity as it stands now is no longer achievable. Because the fully vaccinated can no longer form a protective ring around the unvaccinated. Because the fully vaccinated is no longer 95% protected against infection. It's now only about 45 to 50% protected. Therefore, with an R0 of 6 for Delta variant or to 9, and the current vaccine efficacy of only about 50%, herd immunity can only be achieved if we vaccinate 95% or more than 95% of the population, which is impossible to achieve because in most countries, at least 15% people would not want to vaccinate. And these are people who can vaccinate but do not want to be vaccinated. And of course, we have a lot of people whom we cannot vaccinate because of their age, for example, children. So the ability to achieve herd immunity is no longer possible. So now we are beginning to have to introduce a new concept, which is the fact that COVID-19 is going to be endemic. Okay, endemic is again a public health term, which means that it's here to stay. It's going to stay with the community. We cannot eradicate it. In fact, every one of us, whether you're vaccinated or not, you will encounter the Delta variant because it's going to float around. It's going to infect half the people who are vaccinated, and it's going to infect all who are unvaccinated eventually. Okay. Now the question is this: do you want to encounter Delta with the vaccine on board or without? That is the question we have to ask ourselves. Therefore, the vaccination strategy for the country will have to change. We cannot just aim for 70% and that's it, because the 30% becomes unprotected. We have to vaccinate as many people as possible. In fact, we should aim to vaccinate all, because the unvaccinated will surely get infected eventually. And this includes children. We will have to start thinking about vaccinating children as well, which I will address later. And also it means that booster doses will be required eventually. What is the impact of Delta variant on Malaysia? Now, we are unfortunate that when we get the worst wave is Delta variant, okay? And therefore, we don't see the flattening of the curve despite the closing down economy. Had we done the same and the variant is just the alpha, the earlier variant, the numbers would have dropped down just as we have experienced previously. It hasn't come down because of Delta. And we see the same thing happening in the UK, in the US, and in Israel. So although we would like to blame the government and they are partially at fault, it's also not fully their fault. Secondly, the flattening of the hospitalization and death will occur later. Okay, we are not seeing it yet. We're beginning to see it, but it will occur. And we anticipate, based on the data that we can collect, that for Klang Valley, it will begin to come down, and we will see the impact of the vaccination as we go into the end of this month and into September. Okay. But the total number of cases in Malaysia will remain high because the other states are not as highly vaccinated as Klang Valley. Okay, the infection hotspots will begin to move out of Klang Valley into the other states, and we are beginning to see that already happening. Okay, the other impact is that we have to vaccinate all, and because of the infectivity of Delta, we cannot stop the non-pharmacological SOPs like mask wearing, physical distancing. Therefore, we still have to observe SOP despite being vaccinated. Okay, but we can relax these SOPs when a much higher proportion of the country is vaccinated. Then we may, under circumstances, remove our mask, for example, if you're outdoors and so on. But until then, we have a duty to protect, despite being vaccinated, to protect those who can't be vaccinated, who are yet to be vaccinated, until the percentage of vaccinated is much higher for the whole country. Now, if you look at the figures, this is again yesterday's figure. Selangor and Wilayah Persekutuan, the Klang Valley, the R0 is already dropping below 1, whereas the other states are still above 1. And we need the R0 to drop further for the numbers of infection to come down. What is the impact of the Delta variant on church? I realize that a lot of the people viewing is actually from church background, so I'm just will mention a bit about the church situation. But if you are not Christian or you're not from church, it's still okay, it's still relevant to you in your own religious community. Now, I think this is my personal opinion that we should not have physical church service whereby the whole congregation come together until the fully vaccinated rate is high. And I would put the figure at 80–85% of the Klang Valley total population, not the adult population, but the total population. Which means that we will have to include children from age 12 to 17 in our vaccination program, because otherwise we cannot achieve this more than 80%. And the earliest we can achieve that rate of vaccination will be perhaps in November, December. And the non-pharmacological SOPs will have to persist. So it have impact in terms of physical distancing, gathering, worship, and the social activities that we can have in our faith communities. And this applies to the other faith communities in Malaysia too. How about COVID-19 vaccine in pregnancy? We hear the story about a week ago of the tragic situation whereby one of our very famous Malaysian singer, Siti Sarah, who died from COVID-19 during her pregnancy. Okay, and we know that she wasn't vaccinated because of at the time, you know, in the earlier stages, we are not sure, and therefore vaccination in pregnancy wasn't encouraged. But the situation have now changed. Okay, half a year ago, 9 months ago, we do not have enough data about COVID vaccine in pregnancy, which is true, and therefore most government in the world did not give vaccines to pregnant women. But since then to now, at this stage, we have far more data available, and we now know with great certainty that COVID vaccines does not cause any harm to pregnancy, to both the mother and the baby. It doesn't cause any problem with breastfeeding, and it doesn't cause any problem to fertility, male or female. How do we know that? Because millions of pregnant women has been vaccinated worldwide with no added safety concerns, okay, for them nor for their pregnancy. In fact, even during the trial of the vaccines right early on, this is in July 2020, July last year, there are women who are vaccinated in the trial who didn't realize they're pregnant, but subsequently found out they're pregnant. They have delivered normal, healthy babies. Okay, so now we have got enough data to say that vaccination in pregnancy is supported, is safe, and is effective. Okay, according to the UK obstetric surveillance, and this is reported, that among the babies who are infected, 98% are actually unvaccinated. And of this, 1 in 3 develops pneumonia or chest infection. 1 in 7 actually end up in intensive care unit, ICU, and 1 in 5 ended up having premature birth when they're infected by COVID. And you can see that the impact on pregnant women, on the pregnancy, if they're unvaccinated, is actually very, very significant. Therefore, all governments in the whole world officially now recommends vaccination in pregnancy, including Malaysia. So if you're pregnant or you're not pregnant, planning for pregnancy, if you're already pregnant, if you're breastfeeding, you're not vaccinated, the recommendation is strong, a very strong recommendation is to get vaccinated. Should we vaccinate children? Medical experts say more children in Malaysia are hospitalized for COVID-19. This is also a news article in Malay Mail on the 18th of August. So children are also getting infected. In fact, we look at the data in the United States, 15 to 20% of all infected people now are children, and the numbers is increasing. The reason why it's increasing is because they are not vaccinated at a high rate compared to adults. Although children are less vulnerable and therefore they are less likely to have harm from COVID, nevertheless, COVID infection can cause significant problem to children. Of those who need hospitalization, about 2% of children infected will need hospitalization. Far less than adults, but nevertheless 2 in 100 or 1 in 50 of children with COVID positive needed hospitalization. This is based on data in US. How about long COVID? We heard about long COVID. That means the ill effect of COVID infection that lasts into weeks and months, okay? Although you have recovered from the acute infection, but there's still long-term effect. In the UK, in children, long COVID varies from 1 in 20 to even 1 in 2. Of course, the study on 1 in 2, they includes very, very mild symptoms as well. But how about deaths? Do children die from COVID? Yes, they do. And the rate is 2 in 10,000. And this is the base of Malaysian data. That means 1 in 5,000. Now, if you compare that to the risk of vaccine having a severe reaction, that risk is far, 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 far less compared to the risk of death if you get vaccine, if you get infected as a child. And this is largely in a way because of the Delta variant, which is far more dangerous. And because of that, the numbers may continue to increase as Delta variant infect more and more people. So should we vaccinate children? A lot of countries have decided they should. So France, US, most of EU, United States, Singapore has started vaccinating 12 to 17. China has approved Sinovac vaccine from age 3 onwards. And in fact, United Emirates, UAE, have started vaccinating from 3 years onwards using Sinopharm. And in Malaysia, it's the same. The government has decided that we want to start vaccinating children. starting in September 2021, starting with the older age group, and then followed by the younger age group later at the later age. And for those who are below 12 years old, I anticipate that we will eventually have to vaccinate them as well, but we are now still waiting for more safety data in this age group, although there's no particular reason why it is not safe compared to vaccinating older children and adults. What are the risks? Because this is a concern that a lot of parents have. What are the risks of vaccine in children? So far, we have a lot of data already from the countries who have started vaccinating children. The general risks of side effects are similar to adults. The allergic reaction, the arm pain, the fever, the sore throat, post-vaccination are similar to that of adults. There's one particular side effect that a lot of people are concerned, which is that of heart inflammation. The medical term is pericarditis or myocarditis. And this is more specific for the Pfizer vaccine, the mRNA vaccine. And the amount of people who are affected by this is actually very small. So the data from USA and Israel, whereby they use a lot of this Pfizer vaccine to vaccinate children, is about 67 cases in a million for males. And for female, it's only 9 per million, less in female. And the vast majority are mild cases, okay? And therefore, we recommend that children don't have strenuous activities following vaccination for about 2 weeks. But the thing about myocarditis and pericarditis is that it can be treated with good response. And most of the time, only bed rest is required. But we also have to bear in mind that COVID infection itself can cause inflammation of the heart. In fact, the overall incidence is 1% of all COVID positive people get myocarditis. And if you're seriously ill, for example, if you're in ICU, it affects 60% of all patients. And therefore, if you just look at risks of heart inflammation, having the vaccine is actually safer than meeting COVID and then having heart inflammation from COVID. The benefit of vaccine far outweighs that of not vaccinating. How about post-vaccination antibody tests, which a lot of people are very interested about because we want to test whether we are immune to it or not. Now, we have to bear in mind that most COVID antibody tests are designed to test for previous COVID infection. So they're testing for antibodies if you have been previously infected by COVID. The antibody tests are not normally designed for testing for COVID antibodies after vaccination. Is the difference, okay? So therefore, what tests you do matters, okay? There are tests for antibody levels following vaccination, but they're normally used in clinical settings. And we use it because there are patients like the immunocompromised, people with immune problem, people with cancer who are on immune therapy, do not react to vaccine well. And therefore, when we vaccinate them, we want to know their responses. Therefore, we do tests on them, and their response is not good, then we give them booster dose for these patients. So it's used in that specific term. Now, we also have to remember that the antibody level is not the only thing that protects us from infection. Although that's what we are measuring the free-floating, free antibody levels in our blood. But this free antibody that's floating in our blood will reduce with time, as we know. Is designed that way. But what it doesn't measure are things like memory B cells. For example, we have these cells that remember COVID well, and therefore when we meet with COVID again, we can boost up the antibody levels in the blood. And hence, although you may still get infected, you can get rid of the infection a lot quicker. Okay, and this antibody, these B cells are not measured, not routinely measured anyway. And we also have T-cell mediated immunity, again, which is very important in protection against infection. Again, these are not measured. So just because you have a negative antibody test after vaccination, should you go and take the test, does not mean that you're not protected. It may mean that you have taken the wrong test. And also the test does not test for all kinds of immunity. Therefore, the official, the FDA recommendation is that it's not recommended for as a general test for immunity following COVID vaccination. Okay, and in Malaysia, we also have the same opinion. I want to reassure you that if you have vaccine, you have been vaccinated, and if you are not immunocompromised. In other words, you don't think you have any particular poor immunity, the chances of you not developing antibody is actually very low. So this is a study looking at AstraZeneca and Pfizer. If you think about yourself, I don't think I'm generally immunocompromised. In other words, you're not a cancer patient, you don't have autoimmune disease and so on. If you have the vaccine, there's a very, very high chance, almost up to 100%. After 2 doses of vaccine, you will be immune. You will have the immunity. However, if you think that you're immunocompromised, let's say you have cancer and you're on immune treatment and so on, then a small proportion of people will lack the immunity despite being vaccinated. And therefore, these are the people we need to test with those antibody tests, because we may want to give them booster doses. So what are the new treatments for COVID? Okay, so a lot of people are interested in ivermectin and so on. Okay, I'll just spend a couple of minutes on ivermectin because this is very hot in the social media. So it's an anti-parasitic medication. It's predominantly used in animals against parasites. So a lot of people who have dogs and cats at home, you're familiar with this. And it's also used in human for parasitic infections, particularly river blindness in Africa. Now, ivermectin has been known to have some antiviral properties in high concentration, okay, in laboratory testing. Therefore, it's of interest and it's cheap and it's easily available. And a lot of companies make it. But what are the evidence of ivermectin effectiveness in COVID infection? Now, most of the studies that has been shown in the internet supporting the use of ivermectin, when researchers, medical researchers, doctors who are familiar with research, medical research, look into it, they tend to belong to the poorer quality research. In other words, the studies are not as well designed, they're not randomized clinical studies, and therefore the evidence is not that strong. Okay, but nevertheless, the medical fraternity is interested because if anything helps, anything that helps will be another advantage to all of us. Therefore, there are now many randomized clinical trials looking at ivermectin. Okay, and these are properly done studies whereby the participants are allocated blind. In other words, who gets ivermectin, who gets placebo is not known, and then we want to see the effect. Now, so far, a couple of trials have already reported the outcome, but to our disappointment, ivermectin does not seem to be effective in these 2 particularly randomized clinical trials. Okay, we are still awaiting the trial that's ongoing in Malaysia, which should be announced sometime in September. So this is one of the latest one that was just reported. Effect of ivermectin on resolution of symptoms, getting rid of symptoms in adults with mild COVID. These are among mild COVID people. And ivermectin and placebo shows no difference. So therefore, this particular study, which is a randomized controlled trial, double-blind, does not support the use of ivermectin. Now, while we still wait for the other results, at this very present moment, we have insufficient evidence to say that ivermectin works for COVID. Now, ivermectin, contrary to a lot of information that's stated in the web that says that it's safe to use, I want to caution that there are still side effects, although they are not very common. Ivermectin can interact with medications, for example, with blood thinners. So if you're on blood thinners, you shouldn't be taking ivermectin every day as a prevention for COVID. Okay, you must do it under medical supervision. You shouldn't buy it off the internet and take it yourself. We also know that there's a risk of overdose, as we have heard reported 2 cases recently in the news. And these are the other more common problems, but they're not that severe, okay, but nevertheless can affect. But there are also severe reactions, although they are rare. It can cause ataxia. Ataxia is a condition whereby when you get it, you can lose your balance and you find very dizzy and you lose your balance. Some people get seizure from it, and there are cases reported of coma and death. As a result, ivermectin at this moment is still not licensed for use in Malaysia. And in most countries, and it's only licensed for clinical research. Certainly, based on the incidence of safety concerns, there are more safety concerns with ivermectin than with the current COVID vaccines, which is now well researched. There's far more information about COVID vaccine in terms of safety compared to the information that we have about ivermectin that is used for COVID reasons. And to date, it's still unproven. Okay, so at this very moment, on the 22nd of August 2021, ivermectin is not do not have enough evidence to support its use, and certainly ivermectin shouldn't be used as a vaccine replacement. Okay, get vaccinated. Vaccine is by far the safest way to protect you and your family. How about other treatments? I won't go into this. There's a lot of details. If we look at new treatments for COVID, there are so many of them. There's so many things on trial. I'll just read some of these names. You know, they're so hard to pronounce. The Remdesivir, which is now currently in use already, it reduces the death and severe cases by about 40%. And then you have got all this immunotherapy. Basically, they're antibodies to the COVID. Tocilizumab, sotrovimab, Covit, then the newest, or one of the newest one by AstraZeneca, just have a code name, AZD7442, and so on. Now, all these are very important, not just for treating of COVID, but also as vaccine alternative eventually, particularly for people who can't have vaccine, for example. They have condition that they can't have vaccine, for example, they're immunocompromised. Or they are, for whatever reason, does not respond to vaccine and does not develop immunity. So therefore, this treatment then becomes important for them. But the problem is that all this will still be a long time before they're widely available, and antibody treatment generally are very expensive. Now, one of the reasons for this slide is I want to show you that it is actually a very, very complicated subject. There are lots and lots of medical researchers working very, very hard during this time to overcome this condition, okay? And they're very complicated. Therefore, we have to be careful about simplistic treatment or cure-all or miracle cure that we see in social media and internet, because chances are it's not going to be true, because the subject of treatment and getting treatment actually is a very complicated one, okay? So the experts are doing their best to help all of us overcome this. So it's good to follow the progress and let them do their job and follow their recommendation. Now I'll come to the end soon. Okay, this is online evaluation. So how do we, as a non-medical person with a non-science background, for example, evaluate online information? How do we know what is true, what is not true, what is accurate, and so on? So there are some of the questions that may help you navigate this very difficult area. One is that you want to see who manages that information that you received. If it is a WhatsApp message, if it's just a TikTok message, you have to verify it. Okay, who is doing it? Does it come from the official government? Okay, how do you know that? Most government in the world will have .gov as a handle at the back of the internet address, okay? .gov or in Malaysia will be gov.my, okay? If it's education centers of excellence, like if it's Johns Hopkins Hospital, Harvard, Oxford, it will have .edu or edu.my, okay, at the back of the website address, okay? Or if it's from reputable hospitals, all right? And then you have to ask the question, what's their purpose? Who is paying for it? And you can check on that by looking at the About Us section in most websites. So you can learn a bit about the people who actually runs the website, own the website. Okay, do they have vested interests and so on? How about the original source of information? We get all these things being sent to and fro, but where does the original message come from? It's not good enough to say that a long WhatsApp message and then at the end, Dr. Choong Fong, IZ, because anybody can type Dr. Choong Fong, IZ. We have to make sure the original source is accurate. So we have to look for the original source. And for most articles that are well written, that will reference the original source. Then you can look at it. And most original source should be a research paper that is done by researchers and published in a reputable journal. Okay, your YouTube, your TikTok, your FB, your IG, your WhatsApp is not reliable original source of information. And who reviewed the information? That means who summarized it for you? Is it one person? Is it multiple persons? What are their credentials? Who are they? These are the questions we need to ask. And then lastly is how current the information is. It's something that we don't talk about. I still see WhatsApp messages that come to my feed that is a year ago or 9 months ago. And that is dated. For example, if I make a statement, we don't know enough about COVID vaccines. It's a true statement in August 2020. But in August 2021, we don't know enough about COVID vaccines, no longer true because of the wealth of data that we have already received now. Okay, so take home message, and then we'll have a time of Q&A. Vaccines are effective and safe. We have enough data now worldwide to know that with great certainty. Secondly, because of Delta, we have to follow SOPs for some time to come until a much larger proportion of the population is vaccinated. Okay, and we can no longer go for the herd immunity strategy. We have to go for vaccinating as many people as possible, all if possible, because COVID is going to be endemic. And thirdly, I want to say this to people who are still deciding, who are still not sure, who are still a bit fearful, they are still not confident enough. I want to say this, you can change your mind. You can change your mind because there are new information available now. If you have made up your mind a year ago that you're not going to have vaccination, a year later now, today, you can change your mind. You're allowed to. You can change your mind even if you're previously reluctant, even if you previously have told many people that you're not going for it because you have a lot of reasons for it and you have told the reasons to everybody, and now changing your mind seems like a difficult thing to do because you have, in a way, told everybody you made up your mind, but you can still change your mind. It's not too late to change your mind. And if you do change your mind, you don't have to tell anybody. Nobody needs to know. Okay? You don't have to tell the world. It's good if you do, but if you don't have to. You can change your mind and get vaccinated, make yourself safe, and make your family and your loved ones safe as well. Okay? So with that, I would like to thank you everybody for your kind attention. I know it's a long talk, a lot of information, but thank you for your kind participation. So now I'll pass the time back to Alexa.
Yep.
And then we will take the questions from them.
Thank you so much, Dr. Fong, for a very wholesome presentation. I think you covered a lot of things. There are also a lot of questions already on Slido. So if you're on Slido, if you have questions or you would like to see whether any of the questions that you would like to ask already been asked, please go to the Slido and upvote your question. But what we will do is that I will start off by asking some questions that are very popular, which I think Fong has the answer already. For example, one of the questions that are really upvoted by everybody is the COVID home test kits. Yeah. What do you think about the COVID home test kits that have been approved by the MOH? Are they reliable?
Okay, allow me to share this slide then. Actually, I prepared a slide in anticipation of this question. Okay, home test kit. Yeah, there you go. Okay, I think it's good. There are a few points we need to realize about home test kit. Firstly, is that it has to be approved by the Medical Device Authority of the Ministry of Health Malaysia. Okay, don't just buy a home test kit from Lazada or Shopee or whatever that is not approved. It has to be approved. Okay, and how do you know which one are approved? One way is to look at this logo, Medical Device Authority. So if the test is approved, they will normally have this logo there. Okay, but sometimes, of course, people can print logo on it, right? So if you want to know for certain, you can go to this website, this portal, mda.gov.my. You can screenshot this or and so on, and you can just Google it. Okay, Medical Device Authority home test kit for COVID, and you will get the list of ones that is approved. Okay, so this is the current list. I updated it to yesterday. Okay, as of yesterday, we have 12 home test kit that is approved, and they're mainly based on saliva and nasal swab, so it's easy to use. But I want to caution that this is for screening purpose only. Okay, home test kits are not for diagnosis. There's to help you screen, okay? But to diagnose, you will still, let's say you're screen positive in this test, you still want to do a PCR test, all right? And secondly, you have to time yourself. Let's say you're exposed to someone positive today, you know it today. Testing it today and having negative test is almost 100% certain that you're going to be negative because you're not quite infected yet. The best time to test is actually 3 to 4 days after exposure. Otherwise, your test is meaningless, okay? Now, the other thing I want to just point out is that while the test is very good in some sense, because if you're positive, okay, if you're test positive, chances are very high that you are indeed positive, okay? In other words, it's very, very specific. So if you are tested positive on it, chances are you are infected. But if you are tested negative on the kit, it may not be that you are really negative, okay? Why? You may have tested too early, or the kit test does not pick up the viral particle. Although a lot the kit advertised that if the sensitivity to be above 90%, and you see it all the time in Lazada, Shopee, I checked out yesterday, all of them advertise 95% sensitive. But there's small prints, yeah? Okay, if you look at the small prints, they're only 95% sensitive in patients who are symptomatic or in people who have high viral load. So they sub-selected this group to say the high sensitivity. But overall, if you test it generally, the sensitivity is much reduced, 50 to 80% at best, okay? So we have to bear in mind, if you test positive, chances are you are indeed positive. If you test negative, doesn't mean that you are definitely negative, yeah? Because there's still a chance that you're positive, okay? So therefore still have to maintain SOP. Okay, that's all I want to say about that. Yeah.
Thank you. So the best way is still get PCR to confirm really the test.
Yeah, but home kit test helps because sometimes you don't want to access PCR in the hospital. So it helps, but you have to bear in mind that you have to confirm that with a PCR if you test positive.
Positive lah. Okay, great. Thank you. Okay, let's just go by segment and some of the outvoted questions as well. The first segment is concerning the COVID-19 infection. Now, all of us right now, our favorite hobby daily is to read the daily COVID report. So there were news about, at some point that these daily cases, 20 over 1,000, and today you have just explained to us, doctor, that the cases was also due to the Delta variant and all that, the spreading of the virus. But what do we really look for in order to really understand the report? Does what really matters, the number of deaths, the number of whacks, as long as our healthcare is not a burden, should we then, all go out and eat as phase 1 people are, allowed to eat right now if you are fully vaccinated? So just your thoughts on this.
Yeah, one of this challenge in this pandemic is that suddenly everybody is expected to be a public health expert. And we are not, right? Most people are not public health experts, and therefore it's quite hard to interpret data, okay? Secondly, the government don't release all granular data to the public, okay? Although health professionals can access some of them, but it's not generally available. So what would I look for? I will look for this, okay? Maybe I just share slide again of one of the earlier slides that I did, okay? Basically, I look for the numbers because the numbers will give us a sense of how many cases are there in the community. And therefore, if I do go out, I may be infected. Even if I'm vaccinated, I may carry the infection to other people, all right? So that will give us a good sense. So if this number is very high, that means the virus is in the community. And therefore, the chances of you meeting someone with it is higher. Even if you're vaccinated, you may not be ill from it. You then become a carrier to someone who is vulnerable, okay? So that is what we look for. Secondly, the important figure to look for is actually also the hospital, category 3, 4, and 5, okay? This is very important because this gives us a sense of whether our health service is overwhelmed or not. If these numbers here are in the hundreds and thousands, then we are in terrible, terrible problem, okay? But as we know, over the past few weeks, if you keep looking at category 3, 4, and 5, actually the numbers are gradually dropping. And certainly from my own experience, because I have colleagues who work in government hospitals who are now all designated full COVID hospitals, they are seeing the numbers dropping, okay, in Klang Valley, all right? So I would expect Klang Valley eventually become safe enough so that we can open some measure of economy. And that is going to be the case because COVID is a health pandemic, but it's also an economic one as well.
Yep.
We mustn't forget that, okay? So therefore, we have no choice. But the same may not apply to states that are a bit behind in vaccination. For example, I come from Ipoh, so I also look at Perak figures. So their vaccination rate there is not as high as Klang Valley, therefore it's more vulnerable. Okay, so it's a lot of this data is that we need to digest. But I would say, look at the total amount, look at the cases who that need special vaccination, special care in hospital to just give us a sense of it. Okay.
Great. Thank you, Yifeng, for that. Okay, how about another very outvoted question is that in line with what you have shared, because of the high cases and some hospitals are unwilling to admit at the moment. So what is the best next course of action if you contracted COVID and your blood oxygen dipped to 90 and with the understanding that hospitals might not be willing to admit? Yeah.
I think it's a tough thing. The reason why we have a lot of BID, we all have all these acronyms on the brought in date, okay? BID is because there are people who choose to monitor at home, and because the deterioration is so fast, they don't have enough time to get to hospital, and therefore, by the time they get to hospital, they have already passed on. And this is a very hard thing to negotiate. I would suggest that if you're mild, you're asymptomatic, you tested positive, you're asymptomatic, you can safely quarantine at home. If you have mild symptoms, just your side fever and cough is fine as well. But have some measure of home monitoring. Now, that's another big problem because we need to have accurate devices to monitor your pulse oximeter. Pulse oximeter is a device that measures the oxygen level in your blood. I look at Lazada and Shopee, there are lots of 15 ringgit, 20 ringgit ones. I have no idea how good they are, and then hence the problem. Again, you can check pulse oximeter against the same portal that I showed you just now, okay, for the approved devices, okay, and only use approved devices. They're generally more expensive, but I think it's worth the money if you are really infected. But in doubt, if you're in doubt, okay, if your oxygen level drops or if you're in doubt, get to the hospital and let the doctor, the healthcare worker there, assess you properly, because they are all trained to assess you properly, then to decide whether you need admission or not. I think in Klang Valley, the ability to get the availability of beds are now getting better because the numbers are dropping in hospitals, and therefore we can prioritize more patients who are more mildly affected but still require medical care, and you can get access to medical care a bit easier now because we are now over the worst in Klang Valley. Yeah. But the same is not the case in some other states, by the way. Yeah. Okay.
Okay, great. Yeah, so a lot of questions on vaccines. So let me just summarize some of them. Can you comment on reinfection and the effectiveness of natural immunity developed after one has COVID? Are the antibodies that you have right now sufficient to protect them, and for how long? Should one still get vaccinated if they have been infected? So I think a lot of questions on how long actually the immunity can protect us if you already kena COVID. And the second question was that vaccines that we get, how long is that immunity able to protect us or last in our bodies?
Okay. Now, if you have a COVID infection, all right, you will have some form of immunity against reinfection. But again, just like vaccine, and the same with vaccine, if you are vaccinated, you have immunity against the infection, but your level of immunity will drop, okay? Now, as to how long it is, it's hard to know, bearing in mind, because we're now facing a Delta variant. And Delta variant is relatively new. So we have to collect data now for Delta variant, which we do not have as much data compared to, let's say, your original COVID. I would safely say that you will be fairly well protected anytime from 6 months to a year. Okay, that would be an educated guess for most doctors, which means that you should still get booster for your immunity. For example, if you have COVID previously, you should still get vaccinated, okay? Because that will certainly boost up your immunity, particularly if your COVID infection is a lot earlier, let's say more than 6 months ago. You should get vaccinated. Now, if you just have vaccine, like most of us do, have double dose vaccine, eventually we all will need booster dose. And this is certainly the experience of Israel. So Israel now have got an uptake of Delta variant in Israel, although they vaccinated about 70% of the population. Although the majority are in the unvaccinated group, but among the vaccinated group, you know, the protection is only about 50 to 60% according to their data. And therefore, they are now beginning to give third dose, the booster dose, to people who are vulnerable, the older age group, for example, and so on. Now, I want to re-emphasize again, even when they get infected among these fully vaccinated people, they are still well protected against severe disease. Okay, so vaccine still save life.
True. Great. Also, another question is that I think this is something that you might have to address. Like they hear that is it true after vaccination we should quarantine for 14 days before going out? I think the immunity from vaccine only take effect after that, right?
Yeah, you are only fully vaccinated with high enough antibody levels approximately 14 days after your second vaccine, which is true. Okay, so prior to that, maybe the easy thing to consider yourself not fully vaccinated, and therefore you should take all the necessary precaution. Now, I also noticed a question about the vaccine in terms of Sinovac, because it's true we lack information on Sinovac because most of the information that we hope to get will be from China and so on, because most of the more medically advanced countries have not used Sinovac, okay? Not because we are hiding data, but because we don't have data available. People are not looking at it in such a granular detail. But whatever we can see, Sinovac does reduce the hospitalization and severe COVID, and that remains the case even for Delta. But in terms of protection against infection, it perhaps is not as good as the other vaccines, although the data is just very patchy at the moment. So it's hard to come to a firm conclusion. So they may be the situation whereby Sinovac vaccine, people who receive Sinovac vaccine may be offered a booster dose of the other vaccines sometime in the future.
Yeah. So booster dose is really necessary and then might be offered in the future.
Yeah, it seems that the data now coming in seems to be so, yes.
Okay. So a question that normally asked as well, can your booster jab be different from your first doses of vaccine?
Yeah. From the scientific point of view, there's very little reason why we can't. In fact, a lot of people in the world are already doing it. Sometimes accidentally, for example, let's say you get first dose of Pfizer in UK, and then you came back to Malaysia, right? And then you're not going back to UK again. And then you join the queue here, and then you're given Sinovac. But then you just take Sinovac, it's okay. There are a lot of people, for example, in the United States who are resident other state, other places, other countries, and then they go back to their home country, then they receive Pfizer. So far from all these recipients of different vaccines that we know of, and these are also reported, we don't see any problem with it. Okay, and from the science point of view, also that I don't think there's any specific concern about it. Now, whether these are advantageous, whether it's something that we need to do, we purposely make it a different vaccine, is something that we are investigating at the moment. And worldwide, people are to see if you have different vaccines, does it offer you a wider range of protection? So there's a rationale to think that may do, because Sinovac will induce a certain range of antibodies that Pfizer doesn't. So you mix them together, you may have a greater protection. So there is, and studies are being done at this very moment.
Okay, so I think we await the future data to inform us. I mean, in any case, in Malaysia context, you take whatever offered you.
Yes. At this moment, the best vaccine is the one in your arm. Okay, so you take whatever is offered to you, and whatever, all the vaccines that we have received in Malaysia will protect you very well against severe disease and against death. Yeah.
Great. There's a question on about if you have COVID positive around your vaccination date, right? Should I still take the vaccine? What should I do if you if a person finds themselves in that situation?
If you are COVID positive and you're over the quarantine time, then you just go and have it done. But if you are actively positive, that means you are still shedding virus, you're still symptomatic, you just tested yesterday or 2 days ago or 3 days ago, and you're just coughing, you're feverish, please don't go out and get vaccine because you'll be infecting other people in the vaccine centers. You'll be very safe. You won't get another infection anymore because you're already infected, right? So you must well get yourself well, okay, past the quarantine period, then get vaccinated as soon as you're past the quarantine period.
Okay. Actually, if you do not know you're infected, but you go and get a vaccine, is that effective at all?
It is effective.
Okay.
Yeah. In fact, during the initial rollout in UK, where the numbers of infected are so high, they just jab, they just don't care. They don't even ask the question, are you infected by COVID? You turn up, they stick a needle in your arm.
Okay. Great. This is Malaysian favorite questions because we have example of YouTube videos, people not really being jabbed. And of course, you talk about the antibody after that. So how do you confirm we have got empty jabs since antibody testing not encouraged nor inconclusive?
Yeah, that's an interesting one. I mean, I've watched some of the videos, and then some of them look as if they are really not jabbed. One or two, okay, very few. Now, from my perspective, because I'm also involved in as a PPV in my center, so with jab people, there are a lot of fail-safe things that is not known to public. For example, all the vials cannot be disposed of ourselves. You have to return it. Okay, so therefore, the people who want to try to sell it somewhere else have to account for the missing valves. So there are fail-safe measures in it. Okay. Secondly, if I really want to defraud the system, I won't do it by injecting a empty valve. I would just, the valve is 10 mils, the medicine is 3 mil. I just fill it up to 10 mil. I keep drawing from this valve. Instead of only injecting 6 people, I inject 20 people using the same valve. I dilute it. Who will know, right? There's so many other ways to defraud the system rather than faking empty injection. So I think that one is an honest oversight. It's a human error. So for people who type will know, right? When you type WhatsApp also, you have human error, but you type the wrong alphabet, you type, the autocorrect helps, right? Sometimes it doesn't help, but sometimes it helps. So that's human error. I think that case is a case of a human error. And I don't think it's a systematic defrauding the system, okay? Because there's enough fail-safe process in the whole system to reduce the risk of defraud.
Okay, last question on the vaccine. If I'm fully vaccinated and I come into close contact with positive person, do I still need to observe the 2 weeks home quarantine?
If you are in contact with the full vaccine infected person, yes, you have to observe the quarantine.
Okay. So regardless of whether you're vaccinated or not, the foolproof, safe proof is to really quarantine yourself.
Quarantine yourself and so on. Having said that, that may not apply to healthcare workers, because if healthcare workers have to quarantine after meeting a full COVID patient, then we have no healthcare workers left in the hospital. So it may not apply to certain personnel. But generally, if you have nothing better to do, quarantine yourself if you have met someone who is positive.
Ken, on vaccination in pregnancy now, let's move on. So for pregnant ladies, is it safe to take COVID vaccine together with other injections, for example, tetanus, torsade dose?
Yeah, there's no problem with taking COVID vaccine as you take other vaccines. The person who vaccinated you, the doctors may stagger it so that you won't get maybe too overwhelmed with having to mount immune response to all the different vaccines. So you follow the guidance of your obstetrician, okay? So whatever they recommend, you just follow. Yeah, and the current recommendation for pregnant women is that we advise everyone to vaccinate.
Ken, so that will answer some of the questions on whether you can still get your flu jab after the vaccine jab. Yeah, so yes, you can, but listen to your doctor. Vaccination for children. I think this is at least a foremost question in my mind as a parent. Like, how about children who are already down with COVID? Do they need to go for vaccination later? When? Or do we treat them as normal adults as well? Is it?
I think we should treat children much like adults in terms of their previous infection status and future vaccination. So even if they have had COVID before, they should still be vaccinated, because bearing in mind the protection wanes with time.
Okay. When is it safe to open up schools? You know, there's a talk on October 3rd as the day whereby we will open school. A lot of parents are thinking about, you know, when is it really safe until everybody is fully vaccinated? Would your talk about church opening apply to the school as well?
Yeah, I would say that it is of concern. Yeah, the dilemma is this: we have got this issue of children have been deprived of like 500 days of school for the past 2 years. You know, for 1.5 years, school has been interrupted. So we have to balance that loss of educational opportunities versus infection risk. Now, we have to bear in mind, of course, children can get infected, as I've shown earlier, but they are still far safer than an adult who gets infection. Okay, but nevertheless, as parents, you don't want to take additional risk, right? And there's always that struggle. I think the government policy, although it's not fully declared, that we want to vaccinate children. Okay, certainly from 12 to 17 is unquestioned. I think we want to do that. But we will only do it when we have vaccinated substantial amount of adults. Therefore, it's only stated to start in mid-September. Okay, and if you have children in that age group, register them, follow the government, the ministry's direction, and just go for it. Okay. Now, what we are uncertain is below 12. Which is the harder one to navigate, because the data, safety data, is not available. Now, not available doesn't mean that it's dangerous. It's just that we don't have enough data from the whole world to know that. But thankfully, Malaysia is not at the beginning of the vaccination curve. Therefore, we can observe what happened in other countries. And I think we should be guided by that. Okay. But it means that since we can't vaccinate our younger children so early, it's imperative upon us who can get vaccinated, the adults, the people who can get vaccinated, to vaccinate. So vaccination is not just about you. It's also about the children. It's all about our children and about the children of Malaysia, the children of this nation. And they need to be protected. And the more adults are vaccinated, the more protected they are, because the chances of us passing on to them will be reduced, because although we can't form a total protection like a herd immunity kind of concept, but nevertheless, the ability for us to infect another person if we are vaccinated is much reduced, because our duration of high viral load is a lot lower. Okay? And although it's 50% protection, it's still better than 0% protection. Okay? So therefore, as one way to really help our children is actually, as adults, even if you don't have children, you should get vaccinated for their sake.
Yep. When the time comes, what is the brand of vaccine safest for children? I don't know whether the government will have enough data to offer that, but doctor?
Yeah, we don't know. We will only go by the data that's available. That's medical health, right? I can only present you data that is verified and accurate. It's hard to speculate. Okay, there are also vaccines in the horizon that may be better for children, because they use a slightly different pathways of vaccination. So as the data comes in, we will have clarity. But at this moment, most of the more advanced, medically advanced countries are using Pfizer, because that's what's available to them. So we will probably get more data on Pfizer and Moderna, the mRNA vaccine, and AstraZeneca. The vaccines are used in these advanced countries first. Okay, and I think Malaysia will just follow suit, since we also have access to the same types of vaccine.
Okay, thank you. So right now, we look at the new treatment options. Yeah, you have touched a bit on the Vermactin and some other treatments available. Yes, I'm very sure this is a question that you encounter many times. How does the medical research explain so much publicity that the Chinese herbal medicine is helping the COVID infected? So there are some questions on TCM. How effective are they? So as a medical doctor, how would you respond to that?
Yeah, see, as a medical doctor, I'm trained in looking at scientific data in a specific way. So the way that we look at scientific data is actually to look at the medical evidence and how do we navigate that. So we look at the studies, is it well designed? One group of people receiving the treatment, another group not receiving the treatment. The people who are collecting the data have no clue who is receiving what, neither to the patients and neither to the person who's analyzing the data. It's only after the analysis has been completed, then is reviewed which group is which, so that it's totally non-biased. And that is the highest type of medical evidence that we can give. And the whole of medical practice, okay, is built upon this idea of way of researching. Okay, therefore we always say that this evidence is not good enough, that evidence is not good enough. Okay, now vaccine has undergone this stringent criteria already. Therefore, we know what works. Now the problem with TCM is that a lot of it undergo just word of mouth, anecdotal. Anecdotal means that I share my experience to you, you share the experience to someone else. It doesn't meet the same stringent criteria as a medical trial or a clinical trial. Therefore, it's very hard then to say what works and what doesn't work. Okay, and hence the dilemma. So therefore, you will see that there are very few medical researchers or doctors who come out to say that, okay, herb A is proven for vaccine, because it is not proven in the sense that medical researchers and medical practitioners like myself understand it to be. So it's very hard to give information. They may well have some efficacy. It may work somewhat, but until we see the data, we can't proclaim it as such. Yeah, and hence the challenge. Yeah.
Great. A very personal question, because I've spoken to a lot of people who actually are asking the ivermectin. You're right. I think everyone tuned in right now are just wanting some kind of suggestion to go with that. Now, with what you have presented with us, yes, it's unproven and treatment of COVID is not recommended. But if a person is dying bed, feels nothing to lose, would then all these other new treatment that has not been confirmed to be effective would be something that you would recommend? Okay lah, go and take lah. Nothing to lose, that kind of thing when you come to that stage.
Yeah, I mean, this is a challenging question. That means that you just try anything now. You're in the last stage, right? So just try everything. I think that will be a basis that there are the things that you have to discuss with the doctor at the time taking care of you. Yeah. Because unbeknown to most people in general public, when the patient is in ICU being treated, right, it's not that they're not getting treatment. They're getting the best treatment that we can give, known to us already. They'll be getting their antiviral, remdesivir. They'll be getting some monoclonal antibodies to neutralize and so on and so forth. They're getting supportive treatment. In some centers, maybe not in Malaysia so much, but in all places, when your lung fail, they'll oxygenate your lung using another machine. A machine to oxygenate your lung, so that your lung don't have to do the job, right? So those things are very expensive treatment, but it's there. So a lot of things are being done to help the patient, so that doctors who are taking care of them will do, and those treatments have more evidence based on it. Now, of course, worst case scenario is I want ivermectin, okay, and it's not going to harm you. Take it, why not? I think it's something you want to discuss with the doctor taking care of that person, But it's certainly not something you should take at home, right? Without any supervision, without telling anybody. You're taking one tablet a day, Particularly if you do it instead of vaccine, I think that will be very dangerous, because vaccine, as it stands now, have far more data in terms of safety and efficacy, effectiveness, compared to ivermectin. Far more, I can tell you, far more. So therefore, it no longer makes sense to take ivermectin compared to vaccine. The reason why is this: although ivermectin have been around with us for a long time, its indication is not for COVID, is for parasitic infection. And secondly, the dosage that is thought to be effective for against COVID is far higher compared to that for parasites. So therefore, there's something that we need to bear in mind. Okay.
Can. Okay. we try to answer all the questions. Outvoted questions are all replied already. Thank you so much for your patience. I do have the last question in mind, which is something that people who live in Selangor phase 1 are having choices right now to go out. So what are your views on the recent announcement of opening up restaurants for dining in for the fully vaccinated, with kids that are not vaccinated can tag along with their parents? If one really decides to do this for their sanity, because people struggle at different phase and different, due to cabin fever, for example. So what is your advice to do this safely if one should do so?
Okay, I think our health DG has wisely said that the opening of the economy is an economic decision. It's not necessarily a health decision, okay? But of course, it's hard sometimes to separate the two. Economic and health are interlinked, right? Yeah. So I understand that. So I understand the urge to want to go dining. I have the same urge, I must admit. And if you decide that that is what you want to do for your own sanity, that you want to do, you have to do it safely. Now, I know the SOP for government say that 60% of the staff, how many percent, capacity, 80% vaccinated, how many capacity. To me, they are not very good SOPs to me, okay? I think if you want to dine in a restaurant, you can ask the owner of the restaurant to say if the restaurant is fully vaccinated. And I suspect that a lot more restaurants who have fully vaccinated staff, they will declare that, okay, when you go in, okay. Of course, they can lie, okay. But if they lie and you got COVID, then they can get into trouble for misrepresenting. So you want to, as far as possible, ensure that the staff serving you are fully vaccinated and you're fully vaccinated. And if you do dine, maybe outdoor dining will be safer than indoor dining or in cramped environment dining. And also, before you enter the restaurant, observe quickly how they observe SOP. Are the staff wearing masks properly? Are they double masks? Are they just wearing masks until here with the nose sticking out? Those are things that you can just casually observe, and you will decide that no, they are not really good with SOP, go somewhere else, all right? So I think these are some of the things that you have to think about. But eventually, because we have to go back to normality, we can't live like this forever and ever, right? Okay, and COVID is not going to go away. Eventually, we will have to still go and dine, and we have to take our chances. But of course, if everybody is fully vaccinated, then the chances you're taking is very low.
True.
And therefore, it's okay to take the chances at that time, okay? We are approaching that level of vaccination in Klang Valley, yeah? And I think with time, it will become safer and safer and safer as you dine out. But those who are not who are listening, who are not from Klang Valley, and just look at your local situation, which may differ. Okay, so eventually we will be able to do that. Yeah, much like we see other countries doing it already.
Yeah, and go to stadium.
I think that one is
during
really
football match.
It's a leap of faith.
Yeah, like we are living in a totally different world altogether.
Yeah.
All right. Thank you so much, everyone. Thank you, Dr. Choong Fong, for such an enlightening session on latest development of COVID. We have some questions on like whether he could share the slide and all that. All of these are available on the YouTube. Like I said earlier on, it is available on YouTube immediately after the talk. You can send it to your friends, share it, please. And I think the take-home point today is that while developments are continuing on, and a lot of questions on which vaccine is effective, whether children should be vaccinated. I think a take-home point is, if you know of any adult that are not vaccinated, please encourage them to do that. This is a battle that we cannot win on our own. I think we all have to come together and take necessary measure to help win this whole battle. Okay, so thank you so much, Dr. Fong. Thank you everyone for being patient. Please do fill out our feedback form so that in the future we can also advise you or even suggest to you and invite you to join our talks that might be really good for you to also be part of it. Okay, thank you everyone. Please do go to the PJFC YouTube link for more information and share it with your friends. Yeah, some of the things already, some of your questions on Slido, I didn't take it because they are already been answered. So you can always rewind his talk, okay, and watch it a few times to get the clarification. Thank you everyone.
Thank you, everybody.
Blessed weekend.
Yeah,
have a blessed
Bye.
weekend and blessed
and
week.
keep safe, okay?
Yep.
Keep safe. Bye-bye.
Yes. Bye-bye, everyone.
Bye.
Take care. Take care. Bye-bye. Thank you for joining us for the talk. especially
Bye.
those who are
Bye.
new.
Thanks.
Bye-bye.